Yeah.
One, two, three, 4, 5, 6, 7, 8, 9, 10.
Richardson?
1, 2, 3, 4, 5, 6, 7. Oh, 8. 1, 2. 1, 1, 2. 1, 3. Sunshine. 1, 2. 1, 2. 1, 2, 3. 2, 4, 6. 1, 2. 2. 1.
Get some medicine and keep it later, okay? And I'm dying. My phone's dying.
1,
Boy, be careful.
2, 3, 4,
No, the oxygen.
2, 3.
I know, but I need to get you some more medicine. It says on it.
It's in his throat. That medicine. Not medicine.
8, 9, 10, 11, 12.
So what are we gonna do?
1, 2.
Can't make you fire. It tells you the paper there.
Okay.
2, 3, 4, 5. That was right.
You get home, Gina? Gina, you gonna do your chores?
1, 2.
Are you saving money, Gina?
Yep.
For what?
The book fair now.
You're going through the high school.
Doesn't matter. They're already gone.
That was weird.
Maybe I'll get rid of a few kids and run over them.
You what?
Maybe I'll get rid of a few kids and run over them.
They never got rid of you.
Oh well. They should have got rid of me when they could have.
Popo won't let them.
Okay, well.
Ay, mijita. You're the shortest person in the band. The police that are in the school, two fat guys.
No, they're still.
Go kid.
Log into my computer.
Gina. Shh, don't get near the door. Get away from the door. Gina.
Behave. Burma's trying to listen to this at the same time.
So what do I need to put on my nails?
She didn't see anything that was a constriction up in your nose or anything? No?
That is for the longer guilty sex.
She laid and checked and then she said everything was okay.
Oh, yeah. So that would be better. Yeah.
Who's that? Kelly's, scissors. I got 1, 2, 3. I don't know what your order is.
Well, I got Kelly's because I figured, but I wanted to move this one because we're gonna have to cut. I wouldn't want to do. This is.
Here, Gina.
Right here. I can see my tips on
You
my.
don't want it? It's candy I got from the doctor. Becca, you want it? Becca, I'll drink it. Eat it.
Take care of fingers, we can take care of the body. Okay, got scissors. Okay, get there. Okay.
And the delivery house is there.
Oh, I'm just, yeah,
That's wrong. No, accents are easy. Right, so we're not worried about that right now. We gotta go through the skin, so keep it flashing, so we need flashing. Flash, right? So as I said, most of the time, look at that, we're gonna go right through the flash. But we have to hold the flash up to the track off. So
bigger track. Okay. Thank you.
Go first.
Okay. And then so that's the action.
May or may not have to use right angle. Sometimes we just back. As a suit to my nose. Sometimes we're in a big cavity, so we may have to do that. All right. So practice wise, we can start out small, work our way up, work our way in, basically deeper. So that's basically what I would put up. I'm going to explore toward that. And then I'm going to have another tray that's going to have deeper, even larger instruments. I used to keep those back until I get to that point to where I'm in deeper, then I'll move these back, bring those up. Okay. And it's basically the same instruments, but just longer handles. Okay. So good job. Good speed, good technique, just having an idea of where you want to do, how you want to do things, where you want to put things. Okay. Nothing wrong with that. All right.
Wait. I don't know how far you got through last.
This corner over there.
It's like my least favorite part. I'm clipping all of them.
Oh, yeah.
Drop it.
These are short.
Like this, you got these people right here, it's taking you away from what's going on. There are people out there that say,
I've never seen that. I missed that day. That wasn't too bad.
Should be good. Anyway, you want to That's like the best one. I put it over there. Oh, no.
Details. We have a lot. So you gotta go. Kelly, we're gonna put all of them. It's got a lot of- winds have a lot of vein, right? It's a speeding blood. So it's a lot of when you're in a hurry, you don't hide. Right.
So I can my toes up there.
You start out with 4, and then the more you need, and the more you bring up, because the trees only don't have 6. You might have 12 of these. I'm down to my 4, down to my 6. Okay, I said, okay, in the auto. What do we have? Right underneath that, it's very clear on the mountain. You don't want to be
Yeah.
So I'm gonna put those on now.
You need a job, you don't have to worry about it, you know what you do.
That's why we're doing more.
Deeper, you're in deep, take those. It might be another one after that.
So I would load in a second and leave it up there. Like, can I see?
You ordered one, you passed it. You brought up, you got, set it down, you put your suture, you set your suture, so you can not hold it.
So I can
Just in case they need.
so I can set them up like that. Okay. That's like there.
Right, that way you're not having. You're paying attention to what's going on.
No, I'm all worried about this thing.
You are able to
Kick out
see
of here.
things and anticipate things.
Well, I come in here and talk for myself. And,
Anticipate the answer.
no,
We're back to from the position, we're not anticipating the need.
but I guess I only have 40 minutes for meetings. Yeah, so then that's why it said, we just say 600. So then I was, but Maxine has a different one, she goes to her. So she's unlimited everything. So I didn't. I went back and said, I looked at my email, I said, yeah, I only allowed 40-minute sessions. Because I signed up for the free session. You know how like you guys have that. We have a free session now.
Going on next. Okay.
It's only 40 minutes.
Let me put this in. I'm not gonna have to use weekends because we want to do it. We got a big problem with this.
You just go into zoom.com and then you set up an account. Like I said, you'll get a free one. And once you download it, you just log into Zoom and then they'll ask you for a meeting number, or if you have a request, there's a link. You just click on the link and it'll automatically get you. But if Maxine gives you the ID number on the screen, it it says join the meeting, join the meeting by ID number, and then type in that ID number when I connect you. But Maxine? No, if you will Maxine, because there's automatically before you online, I don't. So, did you tell her you wanted to join Zoom?
I will log in there. You get this part first. Ladies, go ahead.
I'm gonna be working this way. Right? So just going on over here. Right. So this way I can't. I don't know what's going on. So I'm gonna see if we can do this way. I do not need.
Can I see my tips? I have a better ability to understand the numbers. I can see more of the body and I can understand.
If you want to do that, that's completely fine. But no, it's your setup. You have to see everything. You have to know everything. It's your setup. That one, you're doing that. You want to set it up that way? Feel free. Okay? That will not be.
Not for light or not like some for like podium section.
Use penetrating outlets on the grades.
Oh, we don't have storage. We want to be.
We got concentrate plan. Oh, we don't have that. Anything. A lot of people, we used to be able to get this. Now people are trying to eat before.
Milkshakes. Yeah, high protein, like protein shakes.
Yeah. It's better to see what's on one. Right. Yeah, definitely. Nice. Yesterday I started doing well. I did not eat until it was already. Yes. So just snaps in the pocket, put some snacks in the locker, go to it, chomp, 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 and go with this water and brush it and back at it.
So you're allowed to relock like in between places?
While you're ready, it's going to have things like this. It doesn't have Velcro. It's going to have some holes. You utilize those to secure your drink, your opiate reception. Okay. If you not, then that doesn't put it in there. Take one side, take the other side, bring it up like this. Take it out. Correct. You have to remember to take those off. Because guess what? Go in the trash. Go in the trash. Guess what you do? Right.
Oh, fun.
If you can't find it, then you take it out of the picture.
Damn. I don't want to pay for those.
Wait, what did you say for the notification?
So.
So one of those things where let's get that done.
You have instruments onto your grade. You get that there. On the way. You get the bunch of time. Always fun. You know, out of trash. Always fun. Then, if you can't find it, you can have to see it. Then you take it out.
Is that for the check?
Yeah, you're gonna have to pay some to do that. And if they have to take an X-ray of the patient, then you have to pay for the X-ray.
Well, yeah.
It would, actually would help. I've had a large tray of curettes. So there's probably like 20 curettes in there. Right? We take them out of the tray, roll them up in a towel, only take out the 4 or 6 that we need. Roll the rest of them up, stick them in the tray. Someone decided that, oh, well, let me throw this towel away. Pick them up, throw it away. Those are curettes. They make noise. You should have heard them. But the entire tray of curettes went to the trash.
Well, and honestly, how do you, I mean, you would have to literally grab the whole thing. She just grabbed the towel and walked.
Right.
Somebody was out to get you.
I wasn't me.
Like, certainly they won't look.
I wasn't me. I was so particular. Let me take my own instruments down because if something happens to it, they're going to come. Point the finger's going to be at me or I'm. So if I know it, I see it, if I get it myself, whoever's relieving me, they can't say that. Well, it wasn't there. Because I've gotten a phone call. Hey, where is this clamp at? It was there. And I left. And so then they try to throw you in the bus so they keep them from getting it.
So do you count if someone comes to give you a lunch, you count?
Yes. Yeah. You count. Always count. If there's going to be a shift change, count. Okay. Or personnel change or something like that. But they would always say, cover your own blood. Okay. So your instruments are going to be like this. Right? You have to see it. You have to see the tips. All right. You're always working from left to right. Read, right, everything left to right. Correct? Correct. Okay. So put things where you can see it. And don't be so okay. Then you can work. You can pass with one hand this way, you can pass with the other hand.
And you can pick it up.
Pass with the other hand. Okay? But this area, some people get too concerned about this being nice and neat and perfect and pretty throughout the case. Oh, we get one of these. They just gave me this instrument back. Clean it up. That's fine. But don't get so caught up trying to make sure all this is nice and neat and pretty. And you're taking away from what's going on here.
You got a warning sign on them.
Your free meeting will end in 10 minutes. Please upgrade to the paid account for $14.99 a month.
I'm not calling, quick, next.
We'll just use the, yeah. Hey, can you guys see that message?
No.
No. In about 8 minutes, it might just shut off. Yeah. So if it does, my apologies. We have to.
Yeah.
Tell the school to pay it.
Yeah, that's one of my.
Don't do that.
It's only $15 a month. I mean, I spend that on coffee a week.
Mine hasn't asked me yet.
Okay. So, one of the things you think about, why am I going to clean these instruments when they're going to go right back and get dirty again? Don't worry about it.
Don't want to move things around.
But, you know, they shouldn't be like tripping full of blood or anything like that. Most of them they're usually not. Okay. The back table. Some people get concerned that I got to keep my back table nice and pretty. That my instruments are good stuff. And they're overdoing this while surgery is going on. How does that look? They're not paying attention. They don't care what's going on at the field. And then the surgeon starts to do this. They're working. They're working. They start hoarding instruments because they don't want to interrupt you. They're not going to say anything. They don't want to interrupt what you guys going on over there. take it away. So they just start hoarding instruments. You're probably going to see that. Or the tech is seemingly paying attention, but they're talking about whatever that's not even concerning what's going on in the room or the patient or anything like that. They're talking with the nurse that's sitting at the desk, and they occasionally look over, and then sometimes you get that going on, and then you have the assistant and the tech and the nurse over there talking while the surgeon's trying to do surgery.
That was happening a lot at the surgery center. They were all going like snowboarding or something, and the surgeon couldn't go, and they're all talking about someone snowboarding and stuff. You just don't understand stuff.
A lot of places, you're going to see places that are small like that. It's a family atmosphere. You spend so much time with those people that sometimes you spend more time with those people than you do with your own family.
They were talking about renting out the mountain.
I don't know. Maybe somebody has a lot of money. So, but don't get caught up in those things. Don't get asphyxiated on, these little details, and do our job, watching the surgery, anticipating, being attentive to what's going on, because something might change in there, and if you didn't see it or pick up on it, now you're behind trying to figure out what the heck's going on. Okay? I've seen people do it, and I don't know what to do, and the surgeon's getting all upset, and yeah, okay. But if you need to take a picture of this in your brain, take a picture of your setup in your head. You do it the same way every time. The more and more you do it, the easier it's going to get for you. Okay. You see it over there? She was boom, 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 right to the next. Okay. You get that towel, don't fumble with it. Put it down, tuck it, and get to the next thing. Okay. You start here. Okay. One of those other things that a lot of us said, always make sure you do it. Towels. To me, that's your indication of saying, I'm ready to go. Okay. You're going to have a nurse. If you're so slow, you're going to have a nurse. Are you ready to count? Are you ready to count? Are you ready? They're over here like this, ready. Like literally hanging out on your shoulder, making you upset. All of that.
Oh, really?
Sarah, can I pack on this one? Are we still talking about it?
Today I was just trying to have like a normal sandwich, but I need things to try.
Really?
I had breakfast at 5:45 and then I didn't have time to eat. I was left there until I had to go to work.
That sucks.
So my first help, I got a couple of lasagna.
I would have passed out.
It's delicious.
Sorry, guys.
Yeah. Hey, we have to pay for the $15 a month.
We just,
We already,
I don't know.
did we pay for that already?
Sorry, what?
I signed up for my account, do the comments. It only gives me 4 minutes.
What, a minute a month?
So that was my mistake. Are you guys good?
Oh.
No.
I'm thinking on
You know, this picture goes up. They're watching the screen, so they don't really think you really know what you're doing, so they don't. Over here. We talked briefly about hairdressers.
what I'm talking about doing my nose.
What are they doing on vacation?
My unwanted vacation. I wear
Wasn't
my
here wasn't here last time we were going to do that. So. We're going to do it for started with you anyway, so come on over.
I'm gonna get my shirt.
Well, technically, if we ever have to do hairdressing, we're gonna end up doing it on a post-crane patient. Some surgeons do it themselves, some do it. But if you ever have to do it, it's nice to know how to do it. Okay? I would always do, I would take the patient's head and I would hold it up in my belly. Hold it up in my belly, and then I would take, and what you want to do, you want to get basically the hairline.
Do we want to move over so we can see?
Can you guys see?
Woo!
Yes,
Thank you. Yes.
So you want to get
Is that better?
this.
Hey, where's mine, by the way? I gotta clean my windows.
There you go.
Merry Christmas to me.
All right. So back to it. Basically get the hairline. Okay. See how back, how low that you possibly need to get. Some people's hairlines are way up here. Okay. Some people's hairlines are way up nice and low. Or some people don't have a hairline at all. Because if they got hair like that big.
They both.
So, all right, you don't have to take the glasses off. What comes in our dressing packs? Telephone? Yes. What else? Gauze, tape. Kind of gauze.
I was referring to the tape.
I wouldn't use it to okay. 4x4. 4x4.
It's not going inside, right?
And it gives you an extra barrier. Because what family's going to see you dressing, they haven't seen the surgery. They could be open up all the way across here, or they could be open up all the way right around here, or just many different places. Okay, from cranial surgery. Sometimes craniofacial surgeries, one of my favorite surgeries. We take a incision, cut it back in the hairline, all the way across. We just take up the face, pull it out.
See, that's the pictures that bug me.
That's like the best surgery ever. It is. When you see one, you'll be like, yeah.
Did they do those here?
Occasionally. Yeah. So then you got rating clips and stuff like that. But okay, so we take our staple line, we put down our most of the time we use either bacitracin ointment or betadine ointment. Okay, put your ointment on over your staple line, Telfa. Sometimes I would just cut my Telfa in half lengthwise, and then I would just cover that entire area over with Telfa. And I would put the 4x4s on top of that. Some people open them up. Some people just put them in squares. Just find out what works for you. Okay, so you put 4x4s down, and then we started with the curl legs. Okay, glasses. Surgeon. Surgeon preference. Some like the ears in, some like the ears out. So I would always ask, ears in or ears out? I don't care, whatever you feel like. Okay? Then you have, it's easier to wrap if she has this on. If she didn't, you have to figure out how to get all that hair inside of that wrap as well. Okay? It didn't always work that well. Okay? Especially if they didn't get their whole head shaped. Some surgeons would just cut out a landing strip and then you go out there, yep. They walk around town, just look out to the head, and he was like, "What happened to you?"
She had surgery and it was like there, so they're like cutting over there and making it look like a design. Surgery? She had it after surgery. Oh. So she went up here and started going to a hairdresser.
So Curlex, when you roll your Curlex off, even with your ace bandages, you'll find out that it's easier to go this way with it, okay, rather than trying to unroll it like this. See what I'm saying? So, I don't know. I'll use the toilet paper for example.
Under that over.
Okay. Everybody's different. I bet he's about to speak. But it's easier to toilet paper that way and take it and you unroll it. Okay? Some people. That's right. And it's just. And then when you pull it over, they take the other, the new roll and sit it on top of it.
Oh my God, those people deserve to get paid.
Okay.
I bet we used to get away.
Or they just go back.
You don't need it, man. I'll take it.
You know, actually, I would prefer them to put it on top and be lazy than leave me without any.
Okay.
That would suck.
There we go. Just relax. Okay. So I would always start with one side of my dressing. If my my incision was on this side, I'm gonna start on this side and go around. If the incision on this side, I'm gonna start here and go around. And I always get clockwise. So for this, we're gonna start here. Okay. And we're gonna come down, bring it down below the hairline. Okay. Sometimes it helps when you have two people doing this, and sometimes the other person just gets in your way. But if you come there, all right, a couple times around this way. And then once I got that, sometimes surgeons will like it really tight, but you think when this patient wakes up, if it's too tight, it's just going to give them a headache. Sometimes if it's too tight and they had a subdural evacuation, it's too tight, it's creating more pressure in the outside in. Brain responds to that. It wants to relieve its pressure. So it shrink down or swell up. And I've seen brain that's shrunken down, and then by the time it's closed, it's trying to come out of the head. It's crazy. So put it on once or twice around. Okay. Then from this point, go back. Okay, and you volunteer. Finger right there. Okay. Finger there. Finger. Take the other curl. Yep. Start where we end it. Down.
Oops, sorry. Can't see. Couldn't see before, but now I really couldn't see.
Yep.
It's pretty. Quick, someone take my pictures.
He's sitting here.
He's setting my curlers. What?
See a piece of that Metaport tape over there? Okay. How do we use Metaport tape?
Why?
3 squares long.
Is there a spot where it tears off the bisection? 3 squares?
Yeah, 3 squares long.
2. Okay.
Okay. So I would do 1. Okay. That's going to hold that down. Some people will take the tape and nope, you don't want to do that. Now it's too tight. So 3 to 4 squares is all I would ever use. Okay, I got the first 2. All right. Next, they're in the bed, right? They're moving around, rolling their head. I'm like, man, I got this nice, pretty hairdressing on. I do not want you messing it up. One time a surgeon called me at 11 o'clock at night and say, hey, Dale, your dressing came off. Okay, thanks. So I'll take another piece. is why I started doing this. And this backside, between the skin and the dressing, I would put the piece of tape right there
On the skin.
on the skin and the dressing. And that kept it from coming off.
That's gonna hurt.
No, it's not, because this is metaphor tape. Metaphor tape doesn't hurt when it comes off. Did you get metaphor tape?
I didn't get nothing. This fills me full of glue. Ow, that actually does hurt a little bit.
You take care of
But you got you.
it. Okay.
They're not full of them.
All right, so let's show them right here. Show them the other side of your hairdressing. Look at that. Okay.
Someone take a picture. I don't want to see.
You want to see or you don't want to see?
I want to see. I'm blind. I can't see.
Somebody help her, please.
Got to throw a peace sign into the duck lips. Wait, I can't raise my eyebrow. Oh lordy, I look like a mummy.
Okay. Eric, what? You're next.
What's gonna happen?
You can get your hair right.
Come on,
All
bud.
right.
Feel like I'm ready to
15 minutes.
All right.
No, you're not going to talk like that. Did I tell you guys? She would be the one that tries to leave here with that on.
I
driving
don't know
down
how
the
to
street.
take it off. No, I said I don't know how.
Like, man, when you supposed to be driving.
I'm laughing and I'm crying. This isn't fun. Just take the whole thing off like a hat, you know, like a turtle.
With the spin around.
Just grab one end and pull. It'll work. I promise. I've seen it on Scooby-Doo. Down and down we go.
Like unwrapping a Christmas tree.
Woo!
Or like with the light.
They have this other dressing that you can put over that to secure that even more. Stocking that, they use it frequently in burn victims and stuff like that. Like this really mesh, mesh like dressing. Sometimes you see it over the arms, sometimes you see it over the legs and stuff like that. And what they're gonna do, take that, cut this piece about this long, squeeze it, open it up, shine it over the face. Stop nodding the end of it, take the rest of it, pull it up. Hold it.
And do we have them? We didn't go this way, right? We went this way.
Sure. However, every one of it.
We're gonna figure it. Is there enough cause?
So just cover them a little bit.
Basically, the top is really, we're not really worried about it, but we want to have it nice and covered. However, whatever the natural way you're rolling, okay, your total paper is backwards. No, go back. Natural. It's natural. Okay.
What? Stop putting the kick me signs on me there. That one's my arm open.
You kidding me? I thought it was chicken.
Want 2 seconds?
What's not supposed to be sticky?
Hey, remember, you have the whole there too.
Okay.
Well, now.
Whoa.
She was like standing on his hose trying to do it.
Could have been bad. Could have really had to like gauze his head up.
It looks just.
I know, right?
You have to put your tape on
Oh, there you
your
go.
3 to 4 squares.
There you go. Hey.
I like these smaller groups. They're not as intimidating.
Take a picture, call him to work.
I could send it to my boss. I'm not supposed to go to work for another 2 weeks anyway.
They say, you go to school, why you should go to work?
Right. And my work can suck it up. We're being a bunch of hands in the butts. They won't even pay us over.
Feels warm. Here. My hair
It's a
even
little loose.
My hair even moves.
A little loose. You're gonna be shaking around in bed.
Wherever suture or wherever staples were sitting. It was. Yeah. No.
Work day and talk.
Oh.
So what's your caption?
Rough day. Tag it. Kind of headache. Major headache. Migraine.
Really?
All right.
Actually did a decent job. Quite the vision, Derek. Can we take a picture?
It's on the right side. Right temple. Can you take it off?
You don't want a picture?
No, I'm good.
Oh. I already posted it.
His,
No, I posted. Wait, hold still. Put it back. I can put it on his.
too late now.
Like, I was a friend. We could do this.
You guys have any questions? You good?
You see, you're not confetti.
Yeah, I think I got everything.
We're
Okay.
good.
All right.
Thank
You guys have a good weekend?
You too.
You too.
Yeah. When we return.
Okay, wait, Dale, one question before you go. Is this going to be on a YouTube video Maxine's going to upload?
Most likely, yes.
Okay, yeah, because I had a hard time hearing, so I'll just catch up through there. Okay, thanks.
Okay, all right.
All right. Thank you.
Thank you.
Bye.
Bye-bye.
Bye-bye.
Was it there? 'Cause if I